National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, a health expert here at nationalnutrition.ca. Today I want to talk about the topic of erectile dysfunction. Now, this is a problem that can affect many men. In fact, it's a very underreported problem, and it can actually affect up to 1/5 of all males. So it's something that a lot of men suffer with, and they typically will suffer in silence. It's become a topic that we're getting a lot more discussion about nowadays with the release of medications that can temporarily alleviate the problem. You know, everybody knows the commercials for the little blue pill and others. Well, you know, with those commercials has come a discussion about this problem that, because it was about the bedroom, used to be kind of locked away in the bedroom and nobody ever spoke about it. And only now are we realizing how many people can actually be affected by this affliction. So if you do suffer from erectile dysfunction, listen in, because we're going to give you some hints and tips about ways you can manage it. Now, there are a number of causes behind erectile dysfunction, and the specific cause is going to be very important to understand because the different treatments are for specific causes. So some of the main risk factors: smoking and medications. Well, if you do those, quit smoking, and if it's due to a medication side effect, you're going to have to talk to your doctor about that. Maybe see if there's another medication you can try that can, perform the same function without creating the adverse effect of erectile dysfunction. Now, other reasons that you might suffer from erectile dysfunction are low testosterone, prostate problems, so prostatic hyperplasia or prostate cancer, and stress. And so what we're going to focus on are supplements and interventions that can manage these extra causes. Because if it's smoking, obviously quitting smoking is going to help with erectile dysfunction. And if it's due to a medication, you're going to have to discuss with your doctor what an alternative might look like for you. But if you have erectile dysfunction due to one of these other causes, listen in, because depending on which version you think you have, and it may be a combination of them, you can find some supplements that you may find helpful. So if your problem is low testosterone, and that's a very common thing, as men age, their testosterone levels tend to drop. Things you're going to want to look at is a herb called Tribulus terrestris, often called Bulgarian puncture vine. The reason behind that is it can increase your body's sensitivity to testosterone. It doesn't necessarily increase your testosterone per se. What it does is it makes you more sensitive to the little testosterone you do have. So that makes a little go a lot further for you. Then you can use a herb, sometimes referred to as Tongadali. It's Uricomia longifolia jack. It's rather a tongue twister to say, but this herb has actually been shown in multiple clinical trials to increase your testosterone levels, increase free testosterone, or the testosterone that's available to your system. And there's some good studies showing that it can really help alleviate erectile dysfunction. So those two, to help boost testosterone and boost your sensitivity to it, very effective if you think low testosterone is related to your erectile dysfunction. Now, if the problem is due to stress, some things you're going to want to look into are what we call adaptogenic herbs. So things like ginseng, which is a classic stress manager, or rhodiola, they're very effective at helping to reduce cortisol, helping your body to manage stress. Why is this important? Because stress affects circulation, but actually when you're stressed, you can overconvert testosterone into estrogen, creating a relative lack of testosterone, and that can lead to erectile dysfunction. In addition to that, you've got prostatic problems. So if you suffer from prostate hyperplasia or benign prostate hyperplasia, BPH as we commonly call it, you might want to look into things like saw palmetto and Pygeum africans, as this herbal combination has been shown in many clinical studies to help reduce swelling of the prostate and reduce the symptoms of prostatic hyperplasia, things like trouble urinating and erectile dysfunction. Additionally, you can look at things to help boost blood flow. Erectile dysfunction can actually be an early sign of heart disease. So if you suffer from this, take it as a snapshot of your overall health. Something else more major is likely going on. You're going to want to work on your circulatory system, but in the short term, if you're looking to alleviate that blood flow issue, taking high doses of an amino acid called L-arginine can be very effective. L-arginine is turned into something called nitric oxide, which causes dilation of the arteries and can increase blood flow to specific areas. In fact, the little blue pill works by that very mechanism. It increases nitric oxide, increasing blood flow to the penis and alleviating erectile dysfunction. Arginine can perform that same feat without having all the side effects. So if you suffer from erectile dysfunction, or you know somebody that does, hopefully the information in this video has helped them. Please share it with your friends. If you have any questions or comments, post them below. Subscribe to our YouTube channel. And as always, remember, knowledge is health.